Good evening. I'd like to call this Tuesday, March 5th, 2019 Board of Health meeting to order at 7:05 p.m. The agenda is subject to change and includes those items reasonably anticipated by the chair to be discussed at the meeting. Not all agenda items may in fact be discussed, and other items not listed may be also brought up for discussion to the extent permitted by law. WACA Television is recording this and broadcasting this live and will replay it numerous times. Nobody else here, video or audio recording? Seeing none, we will open it up to citizens' participation.
Okay.
Good evening.
Got up here earlier this time. Last meeting was middle. Good evening. Mark Tosti. I would like to congratulate, I usually don't, but the all-town / school and citizens for the silver celebration they had. Network people were there and newspaper people were there. And I read the paper that over 300 people showed up. It just goes to show that when there's a heart in this community, heart town, hopefully we'll get accredited for that, that's what this town is about. And Jake was a fighter to the very end. A class person, sensible person, and the family background. I know a couple of the people in the family and all that from years on, that they were tough right to the very end, along with Jake. To the person I wanted to say congratulations, and hopefully they live through and get by this without too much of a heavy heart, would be Melissa Duca. Right there, side by side, and a couple of Jake's friends that was in the newspaper article I read today that know how it is to understand what life is, how to go on, and to when life cannot give you all sorts of memories. Sometimes memories will end, but with Jake's memory and his orange ribbon and anything orange, the orange will glow on. Thank you.
Nice job, Mark.
Thank you.
And I agree with you 100%. I mean, on a Sunday morning, you know, all the town services there, police, you got fire, you've got DPW, you've got the superintendent of schools there, you've got the town manager there. It was a nice, turned a tragic story into a nice event for the town. And, you know, thoughts and prayers to Melissa Duca and Tony Duca and Jake's father, Mr. Silver. I couldn't have done what they did. Melissa Duca has the strength of people I've never ever seen in my life, so it's amazing. It's amazing. But thank you for bringing it up. Hey, KG.
Downstairs.
We started without you. I apologize.
Fine, not a problem.
And we just had citizens participation, Mr. Tosti as usual. And then Ron, you can probably update us on the February 25th, 2019 decisions at every turn meeting.
Yeah, I'll give you my best shot. Am I allowed to do the brief public service announcement?
Please do.
Okay.
I think that's great.
My wife and I had the pleasure of being able to attend a fundraising event for a few girls in town that are running the marathon, Allison and Michelle Rose. I believe, John, you said you may have some contact for Allison. I think she's running for our town, and Melissa is running for Mass Ioneer. And I believe that Susan Roby may be a contact point in the town if anybody is looking to make a donation to one of these young women that are running for either of the Mass Ioneer or for our town. And if you have any contact info, that'd be great.
I can give out her email address, which is probably best, which is just Allison, ALISON, at WACA-TV.com. That's Allison at WACA-TV.com. That'd be wonderful.
Great.
People could help her out.
Yeah, thank you. Diane and I were able to go to the DEAT meeting. First of all, I think both of us were very impressed with their entire group. It was, a great environment. Is it, KG, is it Smaya or Sumya? Somya does a great job running those meetings. All the members are great. I really think that after you listen to how involved they are, what they do, they're really basically an extension of us. And I did write a nice thank you to their board and or their group, telling them how impressed I was with it, and how we appreciate all their hard work. So I think, Diane and I came away with, and maybe we can expand upon it when she is here, with not really needing to really reinvent the wheel. I don't know that we need a specific task force, although certainly we can still do that, I would assume. But I think there are ways that we can collaborate with them more and know a little bit more about what they do, and keep in contact a little bit more, whether or not it's one of us going to their meetings. Diane and I were potentially going to volunteer to maybe rotate and go to their meetings. I know Mark is supposedly going to their meetings at times, I think. Is that partly right?
Yeah, we should talk to him about it.
So those are good things, but if we can keep more in touch with them and even just help them out, they probably have almost all the plans in place. So just as far as Ashland High School goes, because I guess there's very few incidences in the middle school. I guess there were a few. We each got those emails that there aren't really too many. But if students are caught either in possession of vaping materials or they're caught actually vaping, they're automatically in for basically a day's worth of training, and their parents are informed. They need to do basically a research paper about this. If you're a student athlete, you're automatically suspended because of, I guess, the rules of whatever body governs high school sports for a certain amount of time. The school nurse is informed, the guidance counselor is informed, the athletic director is informed. So there's definitely repercussions for athletes. That doesn't necessarily really hold true for anybody else. Apparently there haven't really been any repeat offenders, so nobody's gotten expelled for this. So those are all good things. As far as the parents being informed, that was met with some shock and disbelief, and others not really really saying too much. I guess it runs the whole gamut, like the rest of everything else. So we basically at the end of the meeting, they also do a lot of surveys with these kids with social norms, and basically what's expected. So I know they have another one of these coming up soon, so they're going to have a little bit more recent data. They try to look at all levels of ways to improve or ways to teach and educate people about it. So on the school level, that's what goes on. On the local level, I think they're depending on what they do as well as what the people in the high schools do, the nurses, the guidance counselor, the principals. They're looking to us, for our regulations. They were very obviously happy with what we have just passed as far as the flavors go. Regional collaboration with the Metro West Health Initiative. Apparently there's 25 communities that we're involved with, and they're trying to regionalize things. I'm not exactly sure what's going on the state level, but we're hoping that maybe there'll be some greater state rules as well. As far as pretty much what they feel like we can help them with, we specifically asked them that question. Okay, you have all these things in place. What can we help you with? And they think that education and help reinforcing what we already know to be as far as the dangers go, as well as informing these kids that a lot of them still think that all they're doing is inhaling flavored water vapor, and, they don't really know exactly what's going on. They were saying they have a lot of tip sheets, if we could make those available, whether they're at the town hall, regarding the dangers of vaping. They had, I don't know how feasible it is for us to do this, they had potentially suggested, this would probably be just a suggestion, not anything we could probably mandate, if potentially at retailers that they might be able to give out tip sheets when they sell vaping materials. They thought that would be very helpful. I said I would absolutely bring that back to the board. They want us to unify, the message that they have, regarding the dangers of vaping, which obviously we all do. They were questioning, are there ways to potentially limit advertising? I know we just got that email from Amy, about the $7.3 billion spent on advertising in these, in the convenience stores. I don't know what we can do with that.
Yeah, if I may, Ron.
Yeah,
I
anything
know
you wanna
DJ
add?
Wilson, the attorney. It's one of our difficult areas that, because of the freedom of information and speech, or rather speech.
Right.
We can't interfere with advertising unless it was part of a lawsuit like the previous tobacco lawsuit, where that was part of their agreement for tobacco cigarettes, that they couldn't advertise on TV or so. Unless you have something like
Yeah.
that, you can't interfere with the freedom of speech.
Yeah, understood. That's
Yeah.
why there was a question mark. I'm just saying things that they brought up to us that we could
I'd love
potentially
to
help
see
them with.
them take it on their own, and say, yeah, we agree with you, we don't want that in the eyes of our children that come in as our customers, but,
Or
you
even,
wouldn't-
even if it's just, where you see things facing on the outside of the store when you're walking by, let alone actually when you're going in, which I think you probably have less control over. They're happy about, our enforcing the rules and penalties, to the best of our abilities. They potentially echoed sentiments where potentially, I think alcohol training, when we renew licenses on a yearly basis, I think we require them. They were wondering if there could possibly be some type of ancillary program with nicotine and vaping and with that type of training. I said, I'll bring those ideas back. Maybe with it's a license renewal, maybe it's something else. Anyway, we can, get the retailers to be a little bit more cognizant of, of what they're selling. And there was a little bit of thought, I guess, that Hopkinton may have a Board of Health regulation regarding vaping, which I wasn't aware of. But, and I haven't done that research yet, but, it's a very interesting meeting, and they do a really nice job there, and I thank them for all of us for all their hard work, because, they're all volunteers, and I was just very impressed with their meeting, and they did a really nice job, and they care about these kids. And as well, there's, two young ladies, one of them that spoke here with respect to the vaping flavors. They attend those meetings as well, and I commended them on how difficult that must be, because it's tough to be a leader like that, and and be against a lot of things that people might think are cool to do when you're a teenager. So I gave those girls a lot of credit, and it's really nice of them to be part of this group. And I tried to reach out to them a little bit. I said, you think that we're just a bunch of adults trying to kind of run your life, which we're really not doing. And they're on our side. They want to see see vaping be decreased, and they see their own peers affected by it. Where there are, I think, as somebody had mentioned before, where they know at least a few kids that really are so addicted that they actually have to take breaks and go out. And it's tough to get these people treatment right now. So that's another thing as well. So it was very productive, and we hope to collaborate with them more.
Well, it's great that you guys went, and you got a lot out of it.
I have one thing that we just want to get the history back here. We had one member from here appointed to that committee. So we should probably send somebody from here.
Yeah, it was for the steering committee, I believe. They
No,
had,
no, that was John, but
Yeah,
for the
okay, you do know
DACD
that.
meeting also that we had put in Judy Margulies for that.
I didn't realize that.
She's no more, so we need to appoint somebody from our board if we can. Take that action.
I'm
we
happy to
can-
go. I
Yeah.
enjoyed their meetings, and
I move that Ron
Yeah.
be appointed as a dedicated member to that committee.
I'll second that.
yeah.
Further
And
discussion?
I think on occasion, for us to invite them here, I think would be nice as well.
I agree. Seeing no objections, all in favor?
Aye.
There you go. Thank you, Ron.
Okay.
Thanks for stepping up.
Welcome.
You know, one good thing I think is coming out of this, and, you know, I mean, this board is, you know, taking some feedback on this, but Food and Drug Administration is accusing 15 national retailers, including Walgreens, Walmart, and several gas station chains, of selling tobacco products to minors. The agency disclosed on Monday, yesterday, that it's considering enforcement avenues to address high rates of violations at the retailers after more than 1 million undercover checks this decade allegedly found high rates of sales to youth. The FDA also sent letters to more than 40 companies that they may be illegally marketing certain tobacco products and e-cigarettes. Federal regulators are concerned about increased nicotine vaping. And one that's being led by our senator, Senator Markey, so, I mean, who wrote a letter in support of us doing it as well. So the pressure's starting to be, you know, seen because the impacts are there and they're documented. So it's good to see that the government's stepping up.
Something we can consider doing, you know, to the point that you made is maybe looking at speaking to our legislators about bringing into the State House the idea of extending TIPS certification to include tobacco products.
It's a good idea. Tips to include tobacco. That is a really good idea.
would that be a separate program, a part of the
Yeah,
TIPS?
well, alcohol is two separate programs too. There's one for serving and one for retailing. So for tobacco, it'd probably be a separate program.
Yeah, we do have the Mass Association of Health Boards, Sarah, I can't think of her, McLaughlin, I think it is, she's done training here for us, but it's not that we get full attendance. So maybe if it's required under TIPS, we could
Yeah.
make it the same way.
Yeah.
It'd be nice to see a room full of vendors here
Yeah.
to learn more than just like sending out a fact sheet about vaping and so forth, so that's great. I wrote it down already to look into training at time of permit for tobacco, so that comes up in November, so maybe we can see if Sarah could do some training as part of the permit. To receive your permit, you'll need to go to this training type deal, if the board's okay with that.
Yeah.
Good.
That's great.
I think it's a great idea. So thank you, Ron, for that.
Yeah.
It was a great update. Any further? All right. Item number 4 on the agenda, Town Water Equality Statement from Dan Marr, our Water and Sewer General Foreman. I guess it's fair to, want to take the lead
Yeah,
on this?
I'd like to address the public first because I requested this come onto the agenda from rumblings I've heard on social media. And I posted to social media earlier this week, once it became part of our agenda, to let people know that a statement would be made. I do want to apologize for implying, because this was my impression, that Mr. Morrow would be here to make this statement. But I'm not too sorry about it because I was hoping that people would show up as a result of that, and no one showed up.
The water down.
But we do have a statement that's part of our public record from Woodard and Curran, the water consultants. And since there's nobody physically in the room, I think that it's probably a good idea to read the last paragraph. And if there's anything that's really important that maybe should be added to it, that Mark, if you see anything beyond that, that you can mention it. But the last paragraph in the statement here from Woodard and Curran reads, although an aesthetic issue as defined by compliance regulations and not a public health hazard, the Water Department is responding to all complaints, and the licensed staff at the House Street Water Plant is evaluating changes to the treatment process for optimum water quality results. So in essence, they found that the color in some cases, in some testing, has been off. They've tested everybody that has complained, but there are no health concerns. But if you have any issues or concerns, rather than posting to social media, where it's perfectly okay to post on social media, hey, I found this in my water, did anyone else have this? There's nothing wrong with that. But what happens when you start making statements that come from sources that you aren't sure of, people start taking them as fact, and then they get stretched into something that's not true, and you create a panic that way. The best solution is to use the same energy you would use to post to social media to write an email to the Board of Health, or to the Water Department, or to DPW, or to someone from Town Hall, a town official who can give you the actual answer to your question. That's the best way to get the answer you're looking for and not create any kind of a disturbance. So to those of you who are concerned, I hope that you're watching. I was hoping that some people would show up and if that you had questions, but that's all I have to say about it.
Yeah, I can add a little bit to it. It's, in the letter, it came from Jeffrey Fournier. He runs the plant. He actually, over the years, has provided tours to our interns that work here in the summers. He also noted that we've had an unusual high groundwater season. I can attest to that. Our groundwater's high due to a very wet fall, and now we're having a very wet winter. And color, as he noted, is not a public health threat, but it is indeed sometimes, as they call, a secondary concern, secondary in respect to the fact that you may not want to drink it if it has a color. But the color in this instance is probably coming, as he noted, from vegetative matter such as leaves. Because what happens is, and that's why they built this plant, is years ago we had issues that were primary concern, that was trihalomethanes. Trihalomethanes are also formed from organic compounds mixing with chlorine, but that's not the case here. And there was some color issues before his time. He didn't realize that when he wrote this letter. And it was resolved by building this, as I said previously at the other previous meeting, we have one of the most high efficiency technical type plants in the country. And so they have the opportunity through the methods they have in that plant to change some of the ways they treat the water. But as the water is received in our wells, and I think there's about 5, they're not more than 50 feet from the Hopkinton Reservoir, they draw in some of the Hopkinton Reservoir leaf matter, microscopic to the degree that what this plant does is filters them out. So as time goes on and groundwater goes down, hopefully this plant will be able to handle it. And as he says, they're going to try to adjust some of the ways they treat right now. So, but again, I think the most important part was what you just read. It's not a public health threat.
Mm-hmm.
Knowing a lot about that treatment plant, I would agree with everything you said wholeheartedly and would say that it is not a public health threat, but it is a concern because treated water can be treated properly in that plant, and I know that it is. It might be, as it's treated, it goes back out to the houses. That might be the issue.
Could be.
Well, I mean, it's
with the water table high, getting in
right.
inflow.
You know, you've got cracked pipes. You've got you know, how many times do we see water main breaks and stuff like that?
Yeah, he mentioned that in his letter, John.
Right.
The water breaks too.
Water breaks. It might be good, and just a recommendation of the board, that we get the water and sewer commissioner in here, and we have that conversation. Because I agree wholeheartedly. I thought you said it perfectly, and thank you for the way you said it. But you could treat the water perfectly, and when it goes back out, it could be a concern. So I think maybe it's just a good dialogue for the town. I mean, we just passed, you know, recently a town meeting, stormwater regulations kind of to this point, you know. A lot of our problems are that we've got leaves in our sewer system and stuff like that, so it might be a good conversation, you know, to see if there's
In our
concerns
water
from.
system as
In our
well.
in our water system as well.
In that regard, if it's a local source that happens between the water department as well as to the pipe that goes into the house, I think we should probably map it based on whatever the complaint comes on a geographic location and find out whether it's localized or it's throughout the town. That way it's easier to
It does
pinpoint
seem to
the-
be a targeted area.
Yeah, then it needs
does
to be
seem to be.
pinpointed, and then maybe some more work needs to be done there to identify and then rectify it. That's
Yeah.
the best way to do it.
Because there's a certain part of town that seems to be
Yeah.
affected by it more than others.
Yeah, it could be construction issues, it could be corroded pipes,
Could
as
be
you
corroded.
said, and then maybe water pressure is high and it is infiltrating inside.
Why don't we get him in for our next meeting, if that's possible? If,
See if I can get him.
yeah, see if we can get him in. All right.
Yeah, if the groundwater pressure is higher, it'll probably feed into the tubes too.
If I can't get Dan in, I could ask the assistant commissioner, depending on which one's available,
Okay.
who was our water and sewer superintendent for many years, so I'll ask one or the other, if they, or
Mhm.
both, you know,
Mhm.
next meeting. Okay, thank you.
Good. Anything else? All right, nice job. Item number 5, discussion on how Ashland can be part of a heart-healthy community. Mr. DeSoni, I think you're a little involved in this as well.
Yes, a little bit, and,
Why don't you go to the podium and talk a little bit about it?
yes, I want to put this town on a positive community. I've been hopping on this on and off for at least 2-3 years. And I came into the office, talked to Laurie there, and I just said, how can this town be recommended? And what does the town have to show to be a heart healthy?
Yeah, I can help a little bit. Mark, on your question, we also sent that request to management, and Susan Roby, I believe, was it Susan Roby that responded? Diane got it from Susan Roby. Diane Mortensen relayed to us from Susan Roby that in 2007, don't quote me on the exact date, but the town accepted what they call the Heart Safe Community, and they put up signs. You may have seen a sign or two in town. I remember seeing some signs as well. This is not in your agenda pack, I downloaded it, but they look like this, and I can make it part of the agenda packet. And Massachusetts has 160 towns that adopted the Heart Safe Community. And what they did when they adopted, not just, 160 towns had to provide AEDs in municipal buildings, which we have, as well as CPR training, which the fire department does. In fact, I went to a recent one myself that was offered from a firefighter, as well as promotion, and having your hospitals ready for a patient that may be coming in for a heart issue. So I'm glad you brought it up, though, because, you know, I'm looking back at 2007, I had forgotten, honestly, so maybe we could energize this project and see if, you know, personnel has changed since 2007. I believe you were a selectman back then, weren't you, John, or close to it?
Not yet, no.
Okay,
yeah.
but it shows you how far back that goes, and so maybe we could re-energize it and ask the fire department if they would like to take this, because we had our changes in fire chiefs and so forth, so it might be something, if the board so wishes, I can ask our fire chief if he would like to reconsider whatever we need to do to continue with this type of effort. It comes from, the program originally was basically created through the American Heart Association, and they call it Heart Safe Community.
Yeah, what Mark is saying is the community being healthy, not community being safe.
And that's another one,
that's-
eating healthy.
That's the one will prevent from any usage of these equipments.
Well,
It's a good goal, Mark.
to KG's point, it's the healthy heart and how the community is faced as a community, how well it's a representation of it. And I thank you, Mr. Mark Rome, sir, especially Health Agents, for bringing that and getting forward. It was 2007. The two signs were on Oak Street, where the big sign is now, and the other one was downtown, next to the now in question Mill Pond rest home. So we had a couple of discussions. I know I don't want to go on this all, but it did add to my idea. To help, to be caring, Mill Pond should not be a sore thumb. we should overpass that, and hopefully we get recommended. And if the board and the town health agent can get into the weeds and get it out there again, and get all the people involved, you will find out that this town would be a worth, hot, healthy, and happy to live in community. It comes back to say, for the good example, or the recent example, is the Jake Silver Strong. Make this a health strong community. Anything else?
I think that there are probably ways that we can tie in projects that are happening in town to the idea of a heart-healthy community. We're talking about the Riverwalk project, right? There are ways that can contribute to the idea of heart-healthy, right? Because now you can get out and walk, and what was the other project which was supposed to connect us with other towns? What was that called? I can't remember.
Charles River.
The
Charles
Charles River
River,
Trail,
yeah.
Upper Charles River Trail.
Biking.
So, the biking trail, yeah.
Yep.
So, yeah, so those things count too, you know, the idea of exercise, and even what Ron was talking about earlier, we have people that run the marathon, right? Now, you don't have to run a marathon to be heart healthy, right? You could just make a commitment to walking 30 minutes a day or 20 minutes a day a few times a week. You know, maybe we can get walking groups together in the summertime.
Okay, and this through the chairman to member Dr. Ron. In the medical field, when a medical personnel gets recognized, what happens on the inside with the paperwork that gets them recognized for? A
I'm not
doctor
sure.
or nurse gets recognized for the service.
Yeah, I mean, I don't know if that happens in an official capacity or just, you know, somebody from an institution that's done an outstanding job. Yeah, I don't really see much of that where I'm at. I mean, you know, you see things in magazines, you know, the best doctor voted here and there. I think most recognition, I think, you know, you'll see reviews, you know, from people going in to see doctors online, and those, you know, a lot of times you'll hear the bad experiences and you don't hear the good experiences. So, but I don't really see much of that
Okay.
exactly where I'm at.
Now to bring back to what that was, is you don't just hear it on the inside, but when a town can be recognized and heard from, and it feels good to the heart to be calm and happy about it. It's a representation of leadership and community pride. So again, it was 2007. Community pride was there, those two sides, and how it got recognized. And if I remember right, there was a little bit of a ceremony.
And if I may, Mr. Chair, KG already heard this, but we were at the Finance Committee earlier, and there were some questions being asked about our public health nurse and what programs that person could undertake if they were full-time, and one was blood pressure checks, and another discussion that came up was that we are an aging population and the need to have blood pressure checked on a regular basis, and offering that as one of our promotional programs. And this could wrap into that same concept, promoting where you can walk, promoting healthy lives with heart-healthy lives. So it could all wrap into that as well, and that would be the ideal opportunity if we can increase that position to some degree. I know KG is repetitive, but you just heard that a minute ago.
In line with it, if you recall that we had a booth in the Ashland Day about a couple of years ago, and we had suggested very other ways to work with taking dance as a program, various dances. It could be ballet dance, or yoga dance, or classical dances, or take your dog and walk. The other one is to go to the supermarket and walk each aisle. You
And
don't
don't
get
buy
bored.
anything.
You don't
Right.
get bored.
Right.
Yeah,
Except that
buy is
buy
different. That
You can't buy
you
potato
don't
chips?
get bored.
Too much temptation.
You don't
there.
get bored, and also it's a warm climate, because if you want to go in the winter, that's when you need to have more walking, because weather is not good, I would say, so you don't go out. So several of those, in fact, I do have some pictures, maybe someday I'll pass it on to you, so put it somewhere that you can.
Now, Mr. Chairman, same question, and to you, Chris, you're the newest member, and I'll let Chairman answer this one first.
I think Mark
The,
just took
the
over the meeting.
town has had its ups and downs, has had its moments. Bad newspaper, media, and all that stuff. Wouldn't this be good to put Ashland in a shiny spot instead of all that in the background?
100%, Mark. Yeah, anything that can make the town that we all love and choose to raise our family and to look good it should be the goal of this board. Absolutely, yes.
And now, Member Chris,
Same question?
same question, and in a different surrounding, because remember when we had the outside thing down by the library, a march for get together, be together? The outside.
Vaguely.
Yeah.
Yes, yeah, I do. I do
Think
recall
that.
Mhm.
And that's what I'm thinking, heart health,
Well,
think that.
You know, any of those type of events, yeah, ultimately, to make our town look good and to make it look great, it's a wonderful byproduct of this kind of stuff. But I don't think we should lose focus of the purpose, and that's to help people be healthy. But there are other great side effects too, like when you look at an event like you're talking about in front of the library, it was a great community event. There's fellowship, people get to talk to each other that may not see each other, you know? And anything that brings people together and builds that sense of community, I think is a plus.
Any social activity of that kind
Yeah, for sure.
reduces the stress and the pressure.
Yeah.
Keeps the healthy heart. So visit markets, Dragonfly and other stuff, actually,
Yeah,
they,
all
all
that
of these
stuff.
things, activities.
Farmers market.
Yeah, yeah.
And now KG,
Oh, yeah.
your turn.
Oh, boy.
I always ask this question, is saying, how long have we known each other?
100
Oh.
years.
Plenty. But
Over 10, 15 plus years?
15 years. Yeah.
And has we changed each other's way of being community-minded and
No, we are the same. Right. Thank you.
Mr. Health Agent Oram?
I thought it was out of it. I'm looking over it.
No, no, I'm gonna just say, again, thank
You
you.
know, now,
Oh,
if,
you're welcome.
Mark, I don't want to interrupt you too much, but if we're being fair, earlier in this meeting, you looked at me and said, as you can tell, I'm not a bodybuilder. So let me turn the question to you.
Go ahead.
How are you going to participate and talk the talk and walk the walk?
Okay. Me and Mr. Oram goes back for the years, he knows my background of stuff like this.
Strike one.
I'm not I'm not gonna make each other strike out though. But to Chris, my late mother was an RN,
Uh-huh.
and she passed at 4:37 p.m. at home on the hospice on the cancer for smoke complications. Her last words was, "I'm not gonna cry when I go, so don't anybody else." And my father, I'm taking care of my dad, I'm a caregiver to him.
Yep.
You've lost a lot of weight in the last year.
It looks
And
good.
kudos to you. You look great. How have you lost a lot of weight?
Well, my doctors, Dr. Sierra, Dr. Hamlin, and the health nutrition in Framingham, the hospital, put me on Defeat Diabetes tour. And the road's still there, and it's not gonna end until actually,
But you're walking more, right? You're active more, right?
I mean, less sugars, less carbs, and being more active, being more myself, and more
Excellent.
outgoing,
There you go.
instead of being inside the cave and not do much. But heart healthy not only goes from town, but it's mostly for families to live through. So please send it through. How they recommend to be a heart healthy community. 2007, that's 12 years ago. Let's bring it up again.
Mark, if I may, did you say Defeat Diabetes Kit?
Defeat Diabetes Tour. It's a
Tour, you said.
yeah, tour. T-O-U-R.
Because I'm just gonna look it up and look at it tomorrow. Thank you.
It's my own, people saying, because you gained the weight, because your blood pressure is going up, the road's gonna be shorter. That road is gonna be defeated and it's gonna go forth. Thank you.
Nice job, Mark. Nice job. Anything further? No? All right. Item number 6. KG, you've got your couple of reports there you want to make.
Yeah, I do. I did sit down with Mark and Laura last week, spent some time in assembling some of the data that I could find, and I'm also reviewing the food permit application that they have submitted that has not been completed yet, so I've done about 30 of them, so I might be going some more in the coming weeks. But I did look at the addendum sheet. My concern was only for the amount of staff that they have for the anti-choke and the certified food managers. And I find there are some of them, which you have the data in front of you in a spreadsheet that I gave it to you. A couple of them are marked in red. The state law, which is 105 CMR 590009, I guess, E, requires an anti-choke person to be available all the time in the restaurant. Now the question is, if they don't make up 100% of it, what do we do? And there are some which don't make 100% of it, so we need to make sure that they are 100%. And sometimes the CFM is also the anti-choke person, and then for a CFM, you know, a PIC or the person in charge can replace a CFM for a short time period. But what happens to the anti-choke if the same guy goes out on vacation? So we need to make sure we address this issue sometime and then enforce it as much as possible. I don't think the food inspector looks at this details of the number of hours that there exist. They only look at whether they have the certificate or not. And similarly with the CFM. Some of them have practically 30% or 40% of their time as a CFM, and the establishment is left without a CFM for 60% of the time they're open. So we need to do this detailed study more, and I'll probably sit down with them again and then get additional data if there is any, because this is the paper that I have received and then we have seen through. So it's a good thing to look at the future and then start working on some kind of additional tools for the inspector to gauge, as well as to the department staff to know where to go and look for it. We have to add to this the number of violations that each one of them do it to know how best their CFM is performing or how this institution is performing. So that is the next level that I can try to do it, but this is partially done. So we need to address this pretty soon to make sure they are come in line with compliance, especially the anti-choke thing. Because sometimes the same staff does both the anti-choke as well as the certified food manager, and they go out, then the institution is left without any protection. So we need to make sure that we address this at some point or the other.
KG,
And
when you refer to anti-choke, right, so when we look at food establishments, so say, for instance, it would be extremely important for Sunnyside Cafe, being a restaurant where people are eating food, to have someone to understand choke
Right.
protocol, where it might not be as important for Market Basket,
Correct.
who does not serve
Correct,
food for
correct.
eating in. So-
Some of them are not required.
Right.
They need to have 25 minimum seats.
Yeah.
Even there, the question that I have is, I don't know what rationale they use for 25 seats. And with 24 seats, the choking doesn't happen.
Yeah.
So most of them end up with 22 seats or 24 seats, so they're below the target level.
Oh, yeah, it's like
So-
that in New York, it was like that years ago with, you had to have, if you had more than 12 seats, you had to have a public restroom,
Yes.
so people would open a small.
It's true. That's where some places have put as NA, not applicable, not
Yeah.
required, so those have eliminated. Some of them, maybe I do still have question, and 2 of them I have redlined it so that Mark or anybody can look at the details and see whether our conclusion is right or wrong, and then work on it later on. Doesn't have to be today, so.
KJ, if you don't mind, I'm looking at anti-choking percentage. How did you derive the number 107, say, for residents at Valley Farm?
They have more number of hours, or 2 people there working. So the total number of hours what I used. Our addendum form has that format to calculate it.
Okay, so with the 84 operating hours and 2 anti-choke,
They have more than 84 hours. I had the number of hours they work on the sheet, so I used that as a percentage.
okay, I was just trying to figure out how you derive the anti-choke percentage.
This is exactly, I took the total number of hours with the anti-choke that they have, the hours of opening, and then I divided.
So they had 2 40-hour employees at 80, and they have 84.
Right.
Okay.
So I
you got the
divided,
80
and that's
over
how I got the
80.
percentage for
It's
it.
the hours that threw me off.
Same way the CFM also. So if
you
it's
took
less
the
than
average.
100, that means we need to pay attention to it.
Okay, thank
And
you.
I was suggesting, Mark, that maybe we could give a safety rank by putting 3 digits of AC and 3 digits of CFM next to each other and give it to them and say,
3 digits of what, I'm sorry?
3 digits of CFM, like the 137% means
Oh.
you're safe by 137, and the other one is 120% CFM means 120. So that higher number means
A
it
rating.
has
Right.
preventive methods, rating. So we could give them an emblem to put it on their doorsteps.
I don't wanna jump the gun, but it is on your, permit too, so,
Yeah.
right.
So, and also Laura and Mark were suggesting that we need to isolate and separate the forms for people who do not require CFM. Some of them don't require CFM at all, like condiment stores and things like that, which they have no prepared food or things like that. So we may want to separate the forms, so I'll work on that and bring 2 separate forms for that.
Actually, in your packet.
Oh, it's already
Yeah,
done?
it's already,
Oh,
already
she's
did it.
already done that. I didn't see that.
Laura was on the ball and did
Oh,
a good job on
wonderful,
it.
wonderful. So I'll review these things, and then maybe we
That's
can
in
come back
everyone's packet.
next time and then
nice job, Laura.
make it robust and approve them before the next season.
The only suggestion I would make is, since this spreadsheet is now part of the public record, if the public looks at it, they may not necessarily know what some of these
Symbols are,
symbols are.
I'll put those
So
things,
just maybe
I'll
put
add
some
those
kind of
things and,
legend.
I'll add those things and send it
Yeah.
to Mark for record.
And where it says like one of the top establishment, they don't have 25 seats, so maybe we should do a column of how many seats they have. I
That's,
don't-
sometimes I say NR, that means not required.
Yeah,
So-
yeah. Well,
And
theirs
some of
just
them,
said
even though
blank.
they don't require it, they have it. So
Yep.
that's
Right.
I got you, yeah.
better.
Which makes, it's nice, it's a
Sure.
nice
But to Chris's point, because it is the public record, you wanna be able,
Yeah,
the
yeah,
public to
yeah,
be
sure,
able
sure,
to.
definitely.
digest.
I'll send those things,
Okay.
information, and then give it to you.
Good.
And that's the food permit. The other thing is that I noticed is, I think some of these applicants that I have seen don't seem to complete their application form, so we need to somehow force them. Otherwise, somebody in the office have to look at it in detail and tell them to come back and do it, which consumes more of their time. So in order to save it, I would rather recommend that the board relook at it and put the things on the web so that they're forced to complete it before they go to the next step. So they automatically have a full application form with proper information for us, which we are missing. So we'd like to look at
So how
that.
do you propose?
Putting
I
this-
don't wanna use the word enforcement, but how do you,
But no, propose is to put this application form on the web, so they have to type it and everything online, and then print it out and sign and submit and give it to us. So the handwriting is not an issue to read. They have a uniform printout, and also they can get the whole data out in a spreadsheet form on the background and do whatever analysis they want to do. All of these things, I had to calculate and type it, which is not required. You can just draw this out and then put it
Just,
into.
and just in case, for some reason, they don't have availability to electronic forms,
They could probably sit
well,
down with
Laura-
it, they
Laura
could,
suggested they come in and she can go over it with them.
they can work here. They can probably,
Yeah.
you can leave a public computer or something, I can probably, and then they can
Yeah,
just
we
own-
could teach them, yeah, that's true too.
We could do that,
use
and
that
then
computer.
Most of the government works, they require online nowadays, they don't entertain any
Yeah,
more
I-
paperwork, so I think the age
Yeah.
has turned.
I'm hoping that we'll see electronic payment, then it
sure,
could all be electronic.
Sure.
Yeah.
But this is important. And also, we need to add a line on that one saying that I think sometimes the payment goes downstairs in the manager's office, which doesn't
It
get
does.
recorded here, so there seems to be an
Well-
issue with it. You know, I look at it and say, there's no payment, and then I go back to Mark and it says M there, that means manager.
What would be ideal is, the whole concept there, in my belief, was to prevent writing 2 checks. So really, and we had this conversation earlier, Laura and I, it would be ideal if we someday get to electronic payments.
It is.
Because
but-
then it wouldn't be
Oh,
difficult, you know.
What,
to-
what is wrong in giving 2 checks?
I think they were trying to make it one-stop shopping, one check, you know, they were trying to make it
A bit
easier
more
for
confusion for
vendors.
us.
It
So
does.
we want to minimize your timing of
Understandable.
spending on that one rather than something else.
Something
And
we
we are
can
struggling
suggest.
hard to get additional help from finance committee, so we need to lessen our burden as much as
Sure.
possible to streamlining it. And the best way to do it is add a line there saying that make a separate check paid to the town of Ashland, mark this Board of Health payment for.
It'd be easier to track. Munis doesn't always help, right? It's Munis that you have difficulty with, Laura?
No, it's fine. I mean, it's just, they get sent as a packet from the town manager's office, so it might be easier to do it separately.
I mean, if it goes on the web, you don't need to even send a packet anymore, you just send an email, that's it. They will have to comply with it, unless the law requires you to send a letter, which you can do that. So we should look into these things, maybe,
Well, last year you talked about making this digital.
right?
And where are we at with that?
We did, but Chris found out that the paperwork was not that much, well, let's keep it, but what I find it the difficulty in reading the information from them, because the handwritten information, that's very difficult to read through it. Sometimes the email addresses, we could make mistakes and it never goes to them, so.
Right.
So that will all be corrected, as well as it will speed up the time and data can be collected on the background with whatever they give us in a spreadsheet, and we can do all of these analysis without spending 3 or 4 hours in calculating these things. And then that gives us sensible information for the health department to see what they can do and how they can improve on it.
We could argue the efficiency on that too.
Sure.
You know, if we may get feedback that they want one-stop shopping, but we're now looking at efficiency as well.
Sure. So we'll have to look at it, so I will take the charge of looking at it and bring it back to the board, and then maybe board make the decision to see what happens.
There is a medium in between, you know, when I spent some time with Mark and with Tom talking about the digitizing the form, we were looking at it from the deeper perspective of making it, you know, a data collection device. And what we ultimately ended up deciding together is that the investment and the cost in making that happen, because it's a much greater piece. It's much more complex than it appears up front, and you'd have to make sure that the data end, the data keeping on our IT side is up to par, and so because of the number, when we looked at the number of forms we had and compared to, say, Boston and other and larger entities, it just didn't seem like a worthwhile investment. But what can be done at very low cost, in fact, almost no cost, and probably in-house, if we have some basic software, is we can make a digital version of the form so that it is in fact a form, so that one option we can present, instead of handing them a sheet of paper to write on, is they can fill it out online and have a typed version that would print, and then we may reduce issues of errors from misreading handwriting. So that.
Building department has a
That's
program.
the only
like
thing, but
that.
Yeah.
even if you do that,
Mhm.
they could miss out on entering something. Keep
No,
it blank. Then
yeah.
what happens? Then
No,
it's a problem.
I
because
understand.
That's why
Yeah.
if you put it online and condition it to accept the
Right.
next line only if the first line is
Yeah.
satisfied, which can be done, and I'm sure Paul, is that the gentleman's name in the IT?
Yes.
Yeah, he has done part of it, so he could probably finish it off
Mhm.
with no difficulty. I'm sure he has required knowledge and required
We've
expertise.
asked them to do different programs like that. It's a matter of the time.
Right.
Because we trying to go digital, it's just timing. Right now, we have a program with the building department for forms, and we're looking to do control forms, and the problem is that the software is controlled by an outside firm, so he is looking at integrating different development departments into our system. So, but he said it's gonna take some time.
I understand, but when you try to attach with many people, then it's always more difficult and time consuming it. And if there is an issue with spending time with Paul, or Paul has some issue with time, I can get software guys who were friends of mine, who are good at it doing these forms. They'll write the software needed and give it
How
to the
much they
town.
gonna charge?
Free.
That's a
Free.
good number. That's a good
Free.
number.
That is a good
Hey,
number.
You'd have to talk with Paul, but that's a
I
good
know,
number.
but they can hand in and they can write it to their own and lock it themselves if they want to. It's not difficult, writing a form like that.
Well, we know what you're
I'm
doing
sure
tomorrow.
Chris knows about it.
So you're gonna take that up?
No, I can. So, all right.
Somebody warn Paul.
So Kit, you're proposing having all of this information digitized so that you can?
Yeah, they can do these things.
You can
Mark
run reports and it'll compile it?
Mark can bring the report out easily. With the press of a button, he can just get the report out.
Pull the data for how many CFMs in town or whatever, you can
Sure,
digitize.
and they can
Once you
find out how many
digitize it,
establishments have 25 seats, how many establishments require anti-choke, how many hours of each person has, that they can get a overall town-wide collect total and then make a ranking for the town. How good we are anti-choke, how good we are CFMs.
All right, good. So you'll take up that.
Yeah. Well, we'll work on it and take it.
And you had one more thing on your.
Yes, I had
report.
2 more things. And
Oh, 2 more.
Yeah. I did attend the Wellness Committee program on 25th February, and they were planning on reaching out to the community, and they have Facebook and Twitter, and they think that fairly effective, but they need more attention to it. Suggested they could come to the public podium here on the Board of Health, which is well watched by the community, and then state what they think is needed to reach out to the community and spread their information about their wellness programs. And Paul has said that he would come sometime, and then depending on whenever the meeting is held, as well as his convenience, so hopefully he will come. And they also had policy updates on the wellness program. I think the school committee has recently approved it. So is on their website. And the adolescent survey is still going on. The Metro West adolescent survey is on. It's not yet completed. And Lisa from the school nutrition, she explained how they're trying to provide healthy food at the cafeteria that they have, and enticing students, and also requesting the staff to adhere to those policies, at least take as many vegetables as they can, even though if they don't eat it, take it in front of the students and work things. So these are the enticing methods by which they want to keep the students healthy. So that's what they're trying to do.
And it's not your traditional 1970s lunch menu. It's very appetizing.
It is,
A
it
plug
is,
for the
it is.
schools.
Well, they're also trying different
Right.
methods. They had mixed vegetables. People didn't like it. Some of them wanted everything to separate, so they're providing that aspect of it
Do
too.
a great job.
So they're trying to see which suits better. They may be liking only one vegetable rather than 2 of them, so take whatever you get it. So that's what they're trying to do. So it's a good thing to work with. They also had some issues with the physical education, because it was coming in between the laboratory work that they had. So there were different students were coming every day for the physical education because of their scheduling with the other courses. Now they've streamlined those so that a set of given students will always be there at that period regularly. They're also trying to adopt some novel physical education, so yoga programs as well as Tai Chi programs, and they've tried out physical movement by creating a puzzle, asking them to solve it by walking around or doing that physical activity. So some students may like it, some students may not like regular drills. So this may be an avenue to incorporate them, so that's a good thing to work with. So they're all doing that, and then I believe Paul might come next meeting or the following meeting, one of those meetings, probably, so that's one.
Kind of fits in a little bit to the heart healthy community we
There you
just
go.
were talking about
Right.
too, so.
All of that,
All good stuff.
nutrition,
Yeah.
physical activity.
You know, it'd be nice to see,
Right.
maybe, hopefully Mark can be here and Paul's here.
Right,
Yeah.
right. And on the Eversource project, we had a meeting last week. We decided we will postpone our selection of the peer review. This is the first time the Conservation Commission is selecting an independent peer review other than the other boards. Usually the planning board peer review would have reviewed our project. That's how it used to do. Now this time they're doing independently. And we need to select ones which will be doing it on 11th March. We have a bunch of them who have given us quote. And in order for the public awareness, Carl Haxton suggested we need to have a TV camera there. This is probably after a long time that TV is coming back to the Concom for a short period, the 11th March as well as 25th March. It's likely that they will be there on the 25th March, 11th March, they might be there, but they not be fully heard. So 25th March is likelihood that they will present their project again so that the public can view that. Eversource. And in that regard, I was suggesting, John, that we should have somebody as a liaison for this committee. And like the Board of Selectmen have Rob Sher as the liaison. Concom has Carl Haxton as the liaison. I think we should have one. And then I can't be there because I'm already on the Concom. So I suggest that, request John to be the member if it's agreeable with other members here. And if it's agreeable to John.
Always happy to help.
Yeah. So should I make a motion to propose your name?
If you so choose.
I do move that John Featherston be appointed as a liaison for the Eversource project from our company.
I'll second that.
Further discussion? Seeing none, what do you think the time frame for this is gonna be?
The time frame?
Yeah.
Well, it's usually one of any of these meetings that they have, that's where you can just walk in and then
Okay.
be a liaison, because that way you can speak on behalf of the board, what our general ideas are, our views are. That'll be easy for you.
Just, like I said, always happy to help, always
Right.
willing to help the town of Ashland, but don't forget, I won't be a Board of Health member after May, so,
Mhm.
That's fine, till then.
okay, good. With that, all in favor?
Aye.
Aye. All opposed?
I'm done with that.
Very nice, good job.
Thank you.
A lot of information there. Number 7, Health Agents Report. Good evening.
Oh, I guess I'm pretty well up to date on the budget. I just spent 45 minutes explaining it to the Finance Committee.
Let's talk about that. How'd that go?
It went well. I thought it was well received, in my view, but again, I would ask audience participation what they thought. I thought they were listening. I didn't expect anything to happen this year, but they had some great questions. I provided the answers. Nancy was there
Nice.
to help out on the medical side of it, because some of it she has to answer. I mentioned how originally we started back in November. I think it was November 20th, or whenever that first meeting was downstairs, where we were choosing between one of the two that I was presenting, the full-time public health assistant, the full-time assistant health agent, and the full-time nurse, and how we chose the nurse. It was a tough decision, as I explained to them, but how we decided on that was based on the fact that I would continue to look for efficiencies as we get more additional medical opportunities into the Board of Health, especially as it relates to promotional as well. And here we are. The meeting consisted quite a bit of discussion on promotional public health, such as heart disease and so forth. So blood pressure was brought up at the meeting as well. Then I went on to say that if that can't happen this year, we've already, and I brought up the present budget, I said we're almost 100% spent on the nursing contractual services, so purchase of nursing services is how the line's written. We're at basically, we have 10,000, there's 9,179 spent, we're at 92% spent. And we've been talking about that all along, so I explained to them that I talked to our financial director, who was at the meeting as well, that's Brittany. And basically noted that from this and knowing what we've been seeing, including information received from Framingham that they will no longer handle our population for vaccinations, that we can expect minimal 10 hours may cover it. It may not. We may be back if we have several TB cases. They didn't give me an answer, but they were asking management what their budget looks like as a whole. So we'll see what happens. Right now, though, which I didn't understand, not understand, but I didn't know yet that they haven't put that 10-hour request into our budget. So it's, if I'm correct in saying that, I'm hoping after tonight's meeting, it might be I would hope it be reconsidered, or again, what'll happen is we'll probably next year be seeking their attention for additional funds. Explained that, you know, when we looked as passionate as we do for the needs, as the whole board and myself, the other part to it was we are realistic about financing, and the opportunity to finance the assistant health director with the revolving funds would bring in, right now we have $48,000 in the food revolving fund, would bring in, I'd said an average of 40 from the revolving fund for food, and tobacco maybe 4 to 5,000. So obviously that's a contributor to it, and I did suggest to them that this person would be involved with other programs we can't have right now due to the limitations, and one would be septic inspection oversight. There's about 30 homes a year, and they're inspected by a septic inspector, and that inspector sometimes installs as well, and there's a conflict there. And it's been recognized at the state level, as I found out from a conference, so it would be to protect the Ashland community residents from any potential of a conflict of interest by failing a system that may not have failed. So that oversight is being recommended by the community out there that are licensed septic inspectors, because they know it's, you know, unfortunate. It's an unfortunate circumstance, and that could bring in probably, if we were charging $200 to $300 for the oversight, there in 30 of them, you know, there's another 6,000. So we're looking. I was talking money with them because, you know, that's part of their job, is to look for where the money's coming from. As it relates to the public health nurse, I explained Framingham, and they asked the question, well, how much did they want? And I said, well, I told them we have $10,000 a year we spend if they were to take our money and take care of our residents. But as Kitty Mahoney noted to us, they took care of 50 of our residents for school entry, as well as 200 residents at the flu clinic. If we were looking at it, I said, they didn't say the 10,000 was sufficient, their health director, when I met with them. So it could be 20, 30. You know, I don't know. You know, we'd have to negotiate with them. But one of the other suggestions was regionalization, and if we do, we may want to look at towns that are of the same size in population, and so we were talking about Medway, Holliston, and Hopkinton as it relates to those similar towns, if we were to consider regionalization, which is another option. I did bring to their attention, we're not in any way unique in Ashland. There are many cities and towns that have various setups where some have sufficient staffing and others don't. And so the state's trying to promote more equity within all the cities and towns in our state. And so we talked about how we could raise money in the public health and nursing part of it, and that would be through reimbursement, on Medicare reimbursement, on flu vaccinations, on even the children that are uninsured will sooner or later have insurance. And we also discussed the need for childhood vaccination. If they're not going to do those 50 students, they're going to knock on our door, because that's our responsibility as a public health department. And that's going to be critical. And I can promise you we'll be getting calls galore, because the need will not be taken care of immediately. Yes, they can go to a free clinic. They have the opportunity for Shrewsbury and possibly the Kennedy Clinic after a couple weeks. That student's losing time in school while they're waiting. Kennedy won't accept them until they have their Medicare. So we talked about that, and in total, just the aging population. With the aging population, is gonna be more demand on this department, and other issues. Fortunately, two of the previous board of health members are on the finance committee, so I didn't have to explain too much as it relates to their understanding of the opioid epidemic, other needs such as vaping, you know, I explained how I was very impressed with how the board took that, because it was a very difficult decision to decide on what you had to decide with the flavors. I said the board understood the economic impact, and at the same time I was explaining how important it is to weigh out the economic impact with the public health issue, and how important it is to make sure you measure those out, and the fact that we recognize the vaping concerns that are out there that are ever increasing. And we talked about other things too, in general, but it was, I thought, good dialogue, and that's what we need to have. And the town manager came in at the end of it, but I did recognize that we understand, and he noted it at the meeting when he walked in, that he is contributing to public health, because he has a position with DA decisions at every turn, as well as he has a position with social services, so it's contributing to public health. And when I walked out, I said, by the way, Mike, I mentioned that also when you weren't in the room, that we appreciate and recognize that, but how important it is to have a medical component to that. Hoarding was also discussed, and how that's increased. So a lot of what we've been through over the 3 months, and I really stress the fact that in the 35 years I've been here, and I know there's some misunderstanding on it maybe, that the Board of Health has always taken a role in the budget, because the Board of Health members have always been very involved. I said, I've always worked for very involved board members. And so the one point that I'll take back myself from it is that maybe next year we'll start in September and finalize it and have our budget in before anyone else, when it's required, usually in the November, 1st of December. I said we started the middle of November, and I'll blame myself for it. I didn't realize they had, as I told the finance committee, you had all your information except for the final part, which was the goals of if we were going to have 1 or 2 positions, but it was always being discussed. So, but as a whole, as I said, I thought it was good dialogue. I don't know, KG, you were there.
They did ask me to speak. I refused to speak. I didn't want to speak on behalf of the board. That's what they wanted me. I said, no, I can't do that. The couple of things I noticed, that they were very much keen on getting some data. They asked about how many TB cases and how many hoarding cases, and then apparently Mark said 13.
I gave him the
What
numbers.
I still stress that we need to have the data. That's very important.
I
Because
agree.
it was a news to me that we had 13 cases of hoarding in the last 1 year. And I haven't seen one single email on the hoarding coming from you.
You won't, KG.
No, you can just mention there was a hoarding case. You don't have to mention the name.
I have.
No,
maybe.
the email that we had to attend a hoarding case or something,
Yeah.
that you don't
No, I
have
mean,
to specify
It's
the.
in our minutes. It's in our minutes. I have discussed them with this
Well,
board.
I can go back and then, don't challenge me on this. I can go back and there's no 13 that I can tell you that.
I won't tell you what they are, but
Okay.
I can't.
No, I don't need, I need to know who they are, but I need to know that a new case was described, attended to, then we know that you're spending time on that.
I
Can't
And then everybody's spending some
necessarily
week.
do
I
that.
have to be very, very, very careful. They're
I understand,
confidential.
without the personal
Yeah.
information.
But they've increased.
Without
tremendously.
violating the HIPAA, one can definitely
You
communicate,
understand,
that's
you
easier.
understand.
That's what we're looking for, the data, that's important. Because we cannot go and justify anybody unless we have some numbers.
And we have numbers.
Yeah, that's
And
what we
they're-
need.
Yeah.
We need to know.
It's touchy, you know, like, just
Yeah.
off the top of my head, right? So let's say there's one case of something rare, and Mark comes in and says, we just got one case of something rare. And then you're sitting in a restaurant in town, you overhear a conversation, hey, my neighbor so-and-so has this rare thing. Now you know who it is.
It's okay.
You gotta be
That,
careful.
that happens,
Yeah,
all three.
yeah, I think we have to, I understand where you're coming from. I think there might be a way to collect data. If we have some kind of insurance, you know, if maybe there's a monthly or a quarterly report, you know, but, you know, we also have to. If we make a decision as a board,
be cognizant
that we
of
say, Mark, we need you to collect the data, we also have to entrust that he's gonna do that as well.
But that's, the reason is that we can't go to them when they deal with numbers, they look for numbers.
I'm with you 100%.
Absolutely, there's
I
no way that we
I
can.
agree with everything what you're saying,
With
but
100%.
Mark did provide the number though,
Yeah.
so,
Not,
I understand what you,
or maybe that
there's a
meeting that we
fine
did.
line between, you know, what, and I think I agree with both sides, but
Mhm.
there's a
In
fine line,
fact,
but.
I brought up Ron's form that he provided to us.
Yeah,
It
yeah,
came
that-
from industry, which had numbers on it.
Mhm.
And I said, this was a great form to work with, and it provided them, as you say, the data that they needed to have. So I thank you, Ron, again, and your wife for getting me that
Yeah.
form.
It's all her. I
Thank
thank
you.
I mean, in fact, as you said that the TB cases require more nurses' time,
Mhm.
you need to log them, and that this is what happens. You don't have to put the name, you can say TB1 and then go and put the TB2, another case. Go through the dates and say, those are the dates that were attended, when this is the time.
Mhm.
We can throw the books at them and say, hey, this is what we're spending, we need help. Incidentally, I did learn recently that the town is getting additional money this year compared to what last year. There's a huge amount of money from the state, I believe.
Mhm.
And so we need to impress on, because our food inspector that goes in there, he just doesn't do the food inspection, he does the other inspections too. And then comes and reports to the other individual, the plumbing inspector and the building inspector, any violations. So that time is also spent from us.
Mm.
So we need to have them to pool some money out of the general fund every year for these food inspectors. That's what's important for us.
But that's a delicate balancing act, because
It is.
one year that you do get an influx of money, i.e. your cherry sheet or your op-ed budget, you might not get it next year.
That's fine,
So-
but I'm not asking a whole lot. A set percentage of the money of the food inspector be spent from the 25% or 30%, whatever it is, because they are getting an early warning from us about how the building code has been violated, so then they can go. They're not looking for it, they're not going and inspecting it, we do it.
We catch it during the
Yeah,
inspection.
that's what you do.
Not
So
catch
you go
it,
and
but
report them, yeah.
Observe it during.
Observe.
Correct, but you're spending time to observe it and then understand what it is, and then report to them, and they do it.
And then I
Before
review,
it gets much worse, they get the information ahead of
as
time.
you heard at the meeting, though, it's hard with a part-time food inspector, so I review Tom's reports and refer it to the electrical or plumbing inspector.
I'm not sure whether he has additional tools. Does he have a flashlight that he needs it if he goes in the night?
He does.
Inspects things on the back of a
Yeah, he does.
refrigerator or whatever it is to see the.
Someday we'll take you on one.
Oh, sure, I'd like to be.
I know you would.
We have a good revenue stream in this town, a very good revenue stream in this town. And considering that we're a town that has almost zero commercial revenue,
I-
we have a very good revenue stream.
I don't know how much of the meal snacks this year came up. I'll go and find out and raise that up too as an additional item.
You know, people have told me that, you know, we don't have enough money. Yeah, we do. We
I do
We
still insist on increasing
We
the
do.
food inspections more than what they have done so far, so. we
Well,
need
and back to the
We do.
part-time, as I said, I explained to them, if I, you. I
Please,
didn't mean
yeah,
to interrupt,
this is a great discussion.
that this is where it would be nice to have the assistant full-time health agent, cause he or she could do the food inspections, the tobacco inspections. We're grabbing money from the food permits and tobacco permits for that part. And then with the septic, as I mentioned, we could almost fund the entire position on those funds that we could create. And I did mention, you know, we have fees for other things, including if there's extra re-inspections and fines. So I brought in the money picture to them as well, that we are always considering how can we help in increasing our budget so that it pays for the needed resources. So that was discussed as well. I'm
Well,
sorry, I didn't mean to
no, I
interrupt.
mean, I think you said it much more eloquently than I would, is that I think we could make the case today, tomorrow, 2 years from now, 3 years ago, that we could self-fund this position.
Almost, yeah. And it would, the advantage of having full-time is you'd have that person during the regular work schedule.
to.
You know, unfortunately, there will be a very difficult opportunity to find someone that can do that, that's in the field and has the knowledge that we have right now with Tom, you know.
Yeah, we were just told that extra money is going to be mostly directed for the public safety, but being good health is also a public safety.
Mm-hmm.
So we need to incorporate in that and then get some money out of that to make sure the community is healthy enough and safe enough for us. to live.
Agreed.
It's a fine line.
Well, and you have the budget there, you can see the major line item is the nursing. I did note to them tonight too that in the landfill contractual, that's routine testing only. And that's where maybe we can make up the difference, that's what the finance director and I discussed, is that the deficit in the nursing line item might be able to be made up with the line item for contractual services, which is routine landfill inspections, and testing the homes nearby. With that said, I did note that we still have outstanding bills that have not been properly defined by our vendor. Our vendor gives us hours of up over 150 hours for a person making a certain amount per hour, but doesn't explain what that person did in those hours. So we've been having dialogue with our previous contractor that we need bills that verify what they did in that 175 hours.
Quantifiable.
But exactly, and when that does come in, then we will have an obligation to pay close to $24,000 to $25,000. And that was for the passive vent system. That's the 29 vents that go straight across the landfill in the front. They were the engineer that had the oversight for that. And I've kept Jen Ball up to date as well on that, you know, we will be probably seeing a bill for that. Hopefully they won't consider it in this line item, because this line item was for routine testing, not the specialized engineering.
John,
Yes, sir.
I know that we have been using someone to take care of the Howard Street landfill. The landfill that's
No,
being
House Street, yes.
monitored and taken care of, but we need to have to incorporate their presentation here in their contract as a part of their
Yeah,
duty
it's
to do
not,
it.
there would be a cost to that.
Well,
but
you
that's
got,
what-
when you renegotiate the contract next year, build into it and say
No,
that
it's,
that has to be done as a part of it without
three-year-
adding any money.
A 3-year contract, KG.
Fine,
But by all means, if you have any questions, ask, because I review the reports.
The best way
and
to
you
put
have
them
report.
on the podium and then get the presentation, that'll be better, because that's when we can think through and ask one
You're
question.
saying Amoresco?
Not the Amoresco, the environmental thing, monitoring person for whom we pay.
That's now EnviroTrack.
EnviroTrack,
It
yeah.
used to be ATC,
Right.
which was ECM or whatever.
So
But-
when we renegotiate the contract, that you need to build as a part of it and saying that
Well,
needs to be part
I'm
of
the-
it.
You always can ask me, I'm the liaison to the reports that come in. Feel free to ask any questions.
I'm just
what is wrong
stupefied
in
after
having
all
them
this
here?
time that we're seeing anything on that.
What is wrong in having them here to present?
The cost, I have a feeling.
Well, I understand, but
I have
you-
a feeling when I go
it's-
downstairs
that's-
to request that, they're gonna
That's
say.
what you need to negotiate
they-
with them.
Well, they constantly talk about efficiency, so, and I agree with them, but there's a cost to having consultants come out to our meetings at night.
It could be
I
super
understand, but
expensive.
when you negotiate next time, you need to build into it and
Well,
say
we
that's
can-
part of it, that's all.
We can see what the cost, we can keep it
Well,
as,
then,
My words, this is one of the worst negotiated contracts in the history of Ashland.
then you go for different people, that's all. You have
I've been
other-
very consistent with that theory for the last about 8 years.
I mean, same
The
contractor is
Amoresco.
doing for ages, so they
this
should be.
one's okay, this one with EnviroTrack's fine.
Right.
But, you know, you can add that as an addendum, and what would happen is you could ask them to sub it out separately and see what that cost would be. These engineers make close to $200 an hour. That's why I'm saying the cost, it's the cost. So, it's unfortunate, they make good money. in
Fight
this
it
field.
for us, don't fight it for them.
Do you have any questions on this report?
Not yet, I haven't read through, I'll read
Oh,
through
okay,
it. and then-
well,
I do only because you brought up earlier in the
Yeah.
year, and I have a lot of history with the landfill. The water table is high this year already.
it's high everywhere.
It's
yes.
high everywhere, but every year that the water table is high, historically, this landfill will pump out excess gas.
It
That's-
seems to be
that's
the
been
way
the
it
history.
falls.
That's been the history.
I will agree, and it seems to be that there could be a push with the groundwater table to push the gas up further, and it finds a fracture across the street, because we have one groundwater well, ground monitoring well rather, across the street that was put in, I think it's 6, that still once in a while will get high hits, and it seems to be, if you look at why, it could be the groundwater table forcing the gas to go a different direction and pushing it up. So the gas should be going, the whole reason for these 29 passive vents was to have the gas go through those and just vent out into the air. We don't want it going under the ground and across the street. We had it happen where they detected gas up near the street, and we did a test of all the homes nearby, and they were okay. But they required us to put additional wells across the landfill, across the street from the landfill. And we do have one that still is of question, not the well itself, but the gas that we see that comes out of that. So the state, I called John Murray, and he indicated, I had to talk to him about something else, and he indicated that we'll just keep, I said, did you get the passive report? He said, yeah, and usually we'll respond if we have to, and they did not. So that's the status, and that's where I'm the liaison between the engineer and the firm that we hire, and management and the board and the state. So that's usually how it's done. But you're always welcome to call, and if I don't have the answer, I'll go get it for you.
Sure.
Anyone, all of you. I don't mean to point to you, KG,
No, I
but
understand.
anyone.
A curious question about, did any of those solar panels move because of the heavy wind?
I can't fathom that that would be the issue. I think John might have some of the underground attributes that are, you know.
No,
causing
it's
it.
not because of that. If underneath that ballast, if there is snow that's frozen and then suddenly melts,
Pushes
it can slide.
Yeah.
Because
It's shaped though.
There's
It's
no
shaped.
friction there.
Yeah. Well, they claimed when they presented, well, you all,
You know,
you
in-
weren't here,
in-
but
in Death
KG,
Valley-
you were here, weren't you, when we?
Right. You know,
approved
in
the
Death
Ameresco?
Valley, that the big rocks, they move
No, I don't
because
think
of this.
KG was here.
Oh, okay, I know you were.
Yeah.
When?
When Ameresco was coming to present, and they
I
were
was
talking
here,
about the.
I was in the audience at that time.
Oh, okay,
Okay,
yeah,
okay.
yeah.
But they were saying how, you know, they should not cause any effect, but that, you know, that
They-
was discussed over and over.
They haven't
and-
seen the moving rocks in Death Valley yet.
Well, if these start moving, then yeah, we could have a problem.
They could be.
Houston, we have a problem, you know, but I hope they don't move, you know. They put stone, as a base.
Yeah,
And then they
the
put them on top of the
water
stone.
can freeze underneath that.
Yeah. No,
And then-
I
and then-
respect what you're saying.
Because of sunlight coming in the daytime, only the
Yeah.
top layer can melt and it still slide through. It's
Oh,
possible.
yeah, I understand.
That's what happens in the Death Valley.
Yep.
So, Mark, it looks like they conclude that everyone except for that one
Yeah.
well is doing well.
Yeah, that.
How long do you think they're gonna give that until they decide you need
They-
another mitigation system?
I don't wanna speak for DEP, but I have a feeling they may see this at other landfills as well. And it's based on underground, what we can't see underground, like almost like a fissure you would find in a ledge when you see a cut through and icicles come through in the winter.
Yep.
Like these fissures get formed, and there could be an open area that the gas is getting through across the street, and it's just not able to be captured in these 29 vents. You think it would, but sometimes it could be gas that's formed after it or very underneath and works its way across the street and up to that gas well. So they may let it go on as long as we keep watching it, because it seems to be doing the job for the other needs.
Isn't-
The whole issue, it seems to be doing a good job.
Isn't there
That's
a
great.
layer underneath in the pit? When they poured everything and then they have a layer underneath?
What pit?
Well,
The vents,
whenever
you
they
mean?
filled it in, they had a layer underneath it.
No,
Filled
this
in
is
the
not,
landfill?
this doesn't have an underlying, this
Landfill.
was not, this is an old-fashioned landfill.
Old-fashioned.
It's not old-fashioned, it's like your typical
Yeah.
landfills. So they only have a top
Yeah.
surface,
It was back in like 11 or 12 when we reshaped it.
Yeah.
We
The
just,
top layer is reshaped, yeah.
yeah.
yeah, we just reshaped it. with-
Covered.
Yeah,
And
we
that,
just
that
covered it,
layer,
yeah.
that
it's-
layer is the one which is.
In 30 years from now, they expect they're gonna have to do it again, because the decaying trash causes the ovulation through the earth, and all of a sudden you got pools of water forming. So, yeah, and that's why Ameresco's 20 years, so, they may have to reevaluate at that point to see if, the landform is changing again. And if it is, they're gonna have to resurface again, so the drainage goes off to the sides and to the back where there's rock, and then it goes down but through that rock into the, like a rock basin. So, hopefully it'll last 30+ years. I won't be here to know. I don't think. I might be. If I am, I'll come back and say, I'm so proud of this work you did.
I don't think it'll last 30 years, so. But I hope I'm wrong.
You never know,
Yeah.
you know, because the work they did in today's world is a lot better than what they did 30 years ago. But that's that. And then, I can give the board an update. Just generally, we had a power, I'm on food inspection reports. Just so the board knows, we had a power outage Monday of last week, February 25th. And what happened, a tree, through the wind we were having that Monday, fell over to Rite Aid and caught fire as it was crashing through the power lines. And I don't think it caused any physical, it didn't cause any physical damage to Rite Aid, but thankfully it didn't. It forced Eversource, who was very busy that day, to shut down all of Route 135 from that point west towards Hopkinton. So that basically caused for 15 facilities to be affected. 2 of them have generators, the middle school and I know the name of it, Waterview Lodge, which is our new nursing home down there. And very impressive with Waterview Lodge. Their generator handles the whole building, including everything in the kitchen. Dishwasher, lights, not just the walk-ins. So, and Lisa's gonna send me a report from the schools. It handles their walk-ins, but I wanted her to let me know if it handles everything, so she's gonna get that to me. Of all the sites I visit, because we're supposed to receive a call from the vendors when they lose power, and we didn't get one call. So we sent out an email on Wednesday. Tom generated some information to our vendors that please be aware, you know, you're required to call the Board of Health when you lose power or a flood or sewage backup or any loss or interruption of any type of service that's involved with the facility. I will give credit to about, out of the 15 and -2 on generators, there were another 9 that were closed. They closed their facilities. And of the others that were open, I went in and said, guys, you have no lights? I said, I told them what they need to do on their refrigeration, tape all the refrigerators, date, time it, we lost power at 12:15, and once they reopen them, check the temperatures again, and if need be, if it gets over 2 hours, which it didn't, thankfully, they may need to open that door quickly, check temperatures on the smaller refrigerators and bring all that food into larger units. Might it be a walk-in cooler, or even better than that, a freezer. So, because a freezer will hold sometimes up to 2 to 3 days, because you got like ice blocks in there. They're all the frozen food products. So we went over with the ones that were open that there's a lot of problems. I said, I can see if a customer is having their lunch. Unfortunately, it happened right during lunch. But I said, you got some liability here too. If they trip and you kept your place open and let more people in, you got liability plus. Never mind the fact that if I'm gonna question, was your food at the right temperature? Unless you're keeping temperature logs, how would I know? So in all respects, it was a lesson learned, and hopefully next time we'll get the calls and we'll inform them there's process. But it brought to light, we talk about training, that I'd like to see training on these type of situations where Tom and I could do emergency action plans with them. Even try to entice them into considering a generator with a Gentran switch. You know, if they want to stay open, so be it.
Sure.
You know, put a generator in.
So if they're required to call you when they lose power,
Yep.
and they don't, are they penalized?
We sent out a reminder. Next time, I think I got, you know, if this happens again, come on, guys.
Right.
You know, I don't mean to say it that way, but once is enough.
The bottom line is, you don't wanna fine them, but if you don't,
Exactly.
you're not,
Yep.
you're not serving any purpose.
Yep.
If you're not hitting them where it hurts,
Yep.
they're not listening.
They got their warning.
Mhm.
There's no excuse at this point.
Good.
And then Tom's been out, and in general, he's found the places he's inspected have been, a couple had to be re-inspected, but all of them that were re-inspected were found to pass. There was no third there was only that first re-inspection. There was one facility, I was fortunate, Tom just happened to be in town, and I just happened to pull it into the house I get a call from the fire department. I said, oh, I gotta go back to town. I said, well, wait a minute, Tom's in. So I called Tom, and he just happened to be across the street, and we had an incident where an employee was handling a bowl, a very large bowl, and it broke in his hand, and he lacerated his hand, and blood did get in that area. And so Tom was right across the street, went over process. They had already cleaned up everything they had to where the blood was, but he went over the process with them. So, and they took care of it. It was good to hear that they knew what to do. That's where education pays off a little bit. But that's the report for the board.
Very good. Any questions? Seeing none, thank you, Mr. Oram.
And green up.
Oh, yeah, you want to talk about that?
Just thankfully, Tamero, I think is the name of the group. They make medical, they pack medical devices. They're going to, thanks to Beth Reynolds, who handles our Facebook for the town, a group that she's helping us with that, but I guess the manager or owner of the place met her a couple months ago, and he wanted to do something for the community, and she suggested our Green Up event. So they're gonna be helping us with some of their membership. We're meeting tomorrow night. Anyone interested who might be still watching us, it's only 8:30, 8:40. You know, feel free. Again,
Yep.
We do have members for the day. That's what we're looking for mostly, but again, if you can help with the setup, we should be fine. I want to thank the Worcester State Department of Public Works. They're going to give us another case of yellow bags. Those are expensive, so that's nice they're doing that. And they said most likely today is what they said. But and we've reached out to our various media outlets already, such as the new Ashland edition or whatever it's called, and WACA. We haven't yet, but we will. And trying to get the word out. There's snow on the ground. Who's thinking of cleaning up,
Right.
green up?
Exactly.
Who's thinking
Right.
of green up, clean up, when you can't even see the ground? But it'll be here before you know it, and that's why we are a group of 3 right now, but we're hoping we have 2 people interested in being on the advisory committee. So we'll move forward. They're to
Is
be
that-
there tomorrow.
That here, Mark?
Right over in that small room across from our office.
okay.
We'll be
Yeah.
there at 5:30.
5:30.
Yeah.
Okay, see if I can make it.
Excellent,
Yeah,
great.
What year is this?
I'll be there either way, though.
I just sent a brochure from last year to Tamero so that the owner of the place would know what it's about and explain in an email. And on that, last year's was the 16th event. This is our 17th.
17. Good.
Where'd 17 years go is what I want to ask. It's just amazing.
It is hard to believe.
Yeah.
It's a great event every year.
Yeah.
I'll be there again this year. All right, nice job. We have a review of our minutes from our February 19th meeting. They're in our packet.
Have no corrections. And if others have no corrections, then I make a motion. I move that we accept the minutes of February 19th meeting as presented.
I'll second that.
The only thing that I wanted to ask, because it's in the minutes, so we can talk about, we heard anything more from the state on Mill Pond Rest Home?
I can update you, not from the state per se, but they did pay their fine. Well, I sent that to everyone.
Yeah.
didn't I? They paid their fine, and today, I think, did I send everybody the note that they want to have an evacuation plan? They're working with St.
You guys saw that today,
Cecilia's.
right?
Did I send that to you all too? Good,
Yeah,
because I
I
want to
sent
keep you
it.
in the loop. But as it relates to, I sent something to Stephen Reardon, and included involving the fire chief about some of our issues, but in the past 2 weeks, no, John.
You didn't include the document, right? The emergency plan?
There was no document.
He doesn't have anything yet.
That's why I said, you know, we opened arms to the, you know, making sure he communicates with the
Mhm.
emergency management director. Yeah. So,
So we will have the document once they have it.
pretty much.
Okay, hopefully.
And we'll hopefully see the agreement to the church.
Mm. Good.
Hopefully. I think that's the,
At least they're
appropriate
making
word.
some, I would say, some
Right.
decent, good faith effort, good faith effort.
Yep.
Right, it's gotta continue though.
Yeah.
I did have a phone conversation with, her name is escaping me now.
Judy Bernice.
Who?
Judy Bernice,
Yes, Judy Bernice,
good.
trying to think of a nice way of saying that. Pass the buck might be, the term that I might wanna use. Little frustrated with the response that I got from her as well, but, I'm told that we will be getting more response
Oh, okay,
from the
good.
state, so
Yeah, well,
guess that's
I
the
know
most
she does the same with me. You know, you
diplomatic
gotta
way
talk
I
to-
can say it, yeah.
She always gets me to Steve, and she almost hands off for her, and it's, you know,
Right, so you've
she's-
had the similar conversation,
Yeah, I know how you felt.
Yep, okay. All right, so we have a motion and a second on the meeting minutes from February 19th. All in favor?
Aye.
All opposed? All right, so that passes. Discuss future agenda topics and meeting dates. Typically, we'd meet 2 weeks from tonight. And that would be what?
19th.
19th. Anybody have any schedule conflict?
Yeah, I'm gonna be away that day, but
You'll be away on the 19th? Alright. Talk about Chris that night, okay?
you can talk about Chris right over here.
Do we need that as an agenda item, or we
Yeah,
just-
yeah,
can we just do that?
Well, we'll just do it.
I move that you talk about me. 19th. Wow,
But,
God.
anything, anybody wants as an agenda item, topic?
I can say that one item that's come up and suggested by Cheryl Sabara is that the board may want to consider age restrictions. And it can get dicey, but it's for the CBD oils they're putting into drinks and so forth. The industry, someone had called me, I can't remember if it was someone that wanted to sell beverages, or maybe someone at a farmer's market, I think it was a farmer's market. And she indicated to me that, well, it's no different from a spice. So, I'm just saying that if you get any feedback, we may have to tread carefully, because if it is no different than a
Opium
spice,
is no different
then
than a flower.
there's no
Yeah.
psychoactive properties to it, so but you know, it's very expensive, so I don't know, I don't know.
Then why do they do it?
Yeah,
If there's no effect to it.
Yeah, I don't know, it's supposed to be to help better your health is what the way I was told at the person that was selling it at the farmer's market.
So, what would this restrictions be, for use?
Well,
or
that's
for-
why we may
For
wanna.
purchase or use?
It would be possibly youth, but then you gotta have good reason why you don't feel the youth should
Yeah,
have it.
You have very little means to monitor what happens in the house.
Yeah, true.
They feed it to the child, who knows?
It may have benefits too that you're taking away from
It
the
is
child,
possible,
so. The one thing that, outside of that we may want to, no, I had it here somewhere. There's something I had down for future meetings. We talked about, making sure Paul's at our meeting to discuss.
Right.
And then tonight at the finance committee, we talked about accreditation for the board, and we may wanna start looking at that in regionalization too, possibly discussing some of those items and raising our fees. That was the other one, possibly looking at our fee schedule and going up a percentage. We haven't done it in 5 years.
It's time.
Excuse me, just so the board knows.
We need to consider
I'll just reiterate something I said in the past, that
fees for the grease trap waiver. We need to have an application, ask them to pay a fee for it.
yeah,
Because they're saving a ton of money by not putting it in.
They give reasons why they feel they don't need it, but we could look into it. That would be a new fee that
Yeah.
you would be creating, and it's a regulation, so I suggest if you do it, you wanna make sure you invite those people if they have any input, just like tobacco.
Sure.
it's, when it comes to fees, and this is something is really important, there's no problem charging fees, but if we are way out of line, then there's a problem. You know,
What we
it's
did-
gotta be reasonable.
We actually made sure that we weren't out of line, because there are laws against that. And there were towns challenged with that. So I sat down with the previous board member, I'd say about probably now almost close to 17 years ago, and we looked at every fee and the time, the overhead, administrative work, and based the fees on that. That was with Arthur Shapiro. Many hours spent in that room over there. It was probably maybe not 15, but 12, 13 years ago. So that we would only be able, so that we would not need to worry about being out of line, but just go with the percent of the cost of living and cost of expense.
Yeah.
So that's why it's a percentage.
And that makes perfect sense, but I also think that you gotta look at comps too. You know, at least in surrounding towns. If a business is looking to open their doors and they're researching what it costs to do business in a particular town, and that makes the
And
difference.
unfortunately, it fluctuates, it does.
Yeah.
I
From
agree.
town to town.
Yeah.
I agree that we need to look at comps, but if the business is trying to open, they was not gonna go to the place where they're already crowded business, because they need to get clientele, so where would they get it?
Right.
I'm not expecting
It's just
somebody
one
from
factor.
Ashland to walk down to some other
Right.
town to just have a pizza there, they'd rather have a pizza
No,
here.
for sure.
No, there are
that-
very
the two
strict
as-
laws, you know,
Okay, we
under
can
the
do it.
Romney administration, when Romney was
It's
governor.
fast.
You cannot charge a fee that exceeds the real cost of it. And it's been challenged, and this town has gone through litigation before because of its fee structure. So you just have to be aware of it.
Yeah.
Sure.
You know, why did you raise the fee? Because we felt like it. No,
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 it's,
right.
we
Right.
spend it,
Or it's been 7 years, so we figured it was time. Well,
yeah.
if we can't prove that it was justified, then we open ourselves up.
So,
Mark, I
yes.
had one question, with the accreditation, what does that exactly mean, and how do we go about doing that? I don't know if you can talk about that,
Well,
or we put
for
it
the
on
next
tonight.
agenda, I can bring you up to date. The statistics I've been giving you for budgets and so forth, the
Yep.
National Association of City and County Health Officials, they're the ones that, with another group, PAHB, Public Health, something Administration Protection. I'll bring all that data to you, but they're the agency that would look at our staffing and look at our facilities and what we're doing to see if we can be accredited as and it's become the new wave. Unfortunately, it's being handled at different ways at different levels. The inconsistency is still out there. Might it be budgets or something like that? But it's the recommendation of, in the future of public health.
Did
So
that
that's-
So
money.
it's basically like a minimum quality
Yes,
standard,
yep,
is pretty
exactly.
much what it is.
Yeah, but I've been
Yeah.
bugging Michael Herbert for this over 2 years,
What's that?
to do the accreditation thing.
Okay, well.
It
I
costs
didn't
money,
know
that's
that,
why he.
yeah. It does, it costs $5,000 to start the process. I was gonna give you all that when I discuss it, but, cause we could be discussing it all
Right. No,
tonight.
okay.
It's
No,
true, it does cost
yeah,
money,
I'm
but
interested to.
in the future, I hope that it'll be a consideration for all our cities and towns in the
No,
country.
that gives an independent approval, seal of approval for our health department, how it's functioning, how the board is
Mhm.
functioning. So it's important, because we can't keep patting our own back, then nobody will believe.
It's no
So
different
somebody
from
else
the
does it, then-
college, the medical field, no different.
Yeah.
We should be accredited
Right.
as a Board of Health.
I agree. All right,
All right.
We
motion to
haven't
make-
approved these, have we? Did you guys approve these?
we did.
John, just
We
one
did.
more
Okay.
potential thing, and if we're
They
all
did?
set,
Oh, yeah, they did.
maybe ever, cause I know we're supposed to, the time after that, to the health award, are we
Mhm.
set with who's getting that and all that stuff, or is that gonna be on
How
the
we
next
doing on that,
item,
Laura?
or,
Which one was it?
We did
The
that.
American
No, I
Emergency Award.
that's,
Oh.
I don't know.
So
Laura
I
must
was
know.
just kinda messing around with the proclamation, trying to word it, and he's gonna he's gonna try and ask some questions about Janet,
Yeah, she's
her
supposed to be
history,
on
like how
tomorrow.
long she was on it, so we can try and add that into the proclamation.
Good.
And,
okay. So it's all
So
set.
we're gonna do that in our
Yeah,
first
the
meeting in
in
April.
April, right,
Perfect.
okay.
Yeah, I had this.
They had a
but-
specific date they requested, right, April 2nd or something? Did they?
If we follow
that way the family
the
could attend
bouncy
it, that's
ball,
April 2nd.
April 2nd.
All right, if all business is done, a motion to adjourn.
There's a motion on the table.
Second.
All in favor?
Aye.
Thank you and good evening.